Okay, so I just came across the word xanthochromia when I was reading about multiple sclerosis, which I was now talking about the possible biochemical findings where you are doing a test for multiple sclerosis. Then I saw something like what xanthochromia, that's like yellowing of the cerebrospinal fluid, and this is due to what hemoglobin breakdown. So let's do more research on it. Okay, so for the xanthochromia, you can see a normal cerebrospinal fluid is usually clear. Xanthochromia is becoming yellow. Alright, so it refers to what? Yellow discoloration of cerebrospinal fluid. Typically is caused by breakdown of red blood cells following bleeding into the subarachnoid space. Okay, so it's most commonly associated with subarachnoid hemorrhage. Okay, sorry, I was actually reading about subarachnoid hemorrhage. Sorry, it was not multiple sclerosis, where it was generally diseases that could be dictated by cerebrospinal fluid analysis. So subarachnoid hemorrhage came after multiple sclerosis. Sorry. So it's commonly associated with subarachnoid hemorrhage. It's often due to a ruptured cerebral aneurysm. Okay. So the discoloration occurs because hemoglobin is like there's breakdown of hemoglobin. You understand? So it's metabolized into bilirubin. So it gives the cerebrospinal fluid this yellow color. Of course, you know that excess bilirubin is what causes jaundice. Your eyes should be yellow. So anything that is related to bilirubin is usually yellow. So xanthochromia usually appears 6 to 12 hours after bleeding and can persist for several weeks. So detection method is what? Visual inspection and centrifugation of what cerebrospinal fluid. Of course, you can visually see it. This one is a cerebrospinal fluid stained with blood, like fresh blood. This one is bilirubin. Shows that there has been a breakdown there. So also spectral photometry. It measures light absorption at specific wavelengths to dictate bilirubin. Okay, so that's just what xanthochromia actually means.